You probably looked in the news and seen a lot of the different information out there about the connection between heart disease and diabetes and oral health, and that's something that's really important to us. Healthy heart dentistry is a concept that involves the relationship between the mouth and the rest of the body. We see a number of patients who have some significant gum problems. And when we treat those gum problems, one of the things we want to look at is that there are some different chemicals in your body that are created when there's inflammation in the body. And the body gets inflamed, and gum disease is a source of inflammation, but you can also have heart disease, for example, that would be a source of inflammation. So when you have inflammation in your body, we have a way of tracking whether our treatments for the gums make all the inflammation go away. And so what we do is we solve that problem, and then we look and see if you still have inflammation, looking at the C-reactive protein. If it is, then what we do is we send you back to your physician and say, hey, we treated the gum problem. Now let's take a look and see if there are other sources of inflammation, like perhaps heart disease in your body, that could be causing problems. And it's amazing how many patients that we've had that we've sent in for an evaluation by their physician and discovered that they have heart disease. That's kind of a scary thought in one respect, but it's also a very, very, very fantastic thought that we found it before it became a huge issue for them. Another one is diabetes. We have a way of tracking how a person's blood sugar has been for the last 3 or 4 months using another chemical called A1C, and we can look at that one and say, hey, this person has a tendency toward diabetes. It could be one of the reasons why their gums are inflamed. And then what we do is we treat the gum tissue, but we also send them to the physician and have that evaluated too, and discover in a lot of cases that people do have diabetes. And so getting that handled and taking care of it so that the person doesn't have a long-term problem that is masked by the fact that they have gum problems, is very satisfying, because it helps the patient in ways that are way beyond what their dental health is all about.